Well, hey, welcome to Clearstone. My name is Robert, and what brings you in today?
Getting back, chest, and face, hopefully.
Perfect, sounds great. And you mentioned earlier that you have done laser hair removal before.
Yeah, I've got my full legs done.
Perfect. And how were those results?
After 6 sessions, no hair pretty much.
Fantastic.
Got a little bit left.
Yeah. Do you know what type of technology that they were using?
Not actually. I just know it's a German laser, and that's about it.
Gotcha. Okay, no worries. Any complications for the response?
No. Redness is usually gone within 30 minutes after the session, so.
Fantastic. No itching, no pigmentation changes.
No pigmentation, no ingrowns, so.
Sounds good. So pretty straightforward.
Yeah, pretty stock standard.
Excellent. Sounds good. All right. Well, we expect the same here for sure. You're a great candidate. Light skin, dark hair, very easy for us to treat. So we'd expect the same thing, some redness following the treatment. And then with a pretty quick resolution of it, just like before, you're going to want to avoid a few things before and after the treatment, but we'll go all that here in a moment. So what I'd like to do is just do our general consultation, go over what we do here at Clearstone, what perhaps sets us apart, go over some of the risks and benefits, and then if you're all set, we'll go ahead and begin the treatment.
Sounds good.
Sounds good. So the first thing, of course, we like to introduce folks to our technology. We use systems that we actually manufacture ourselves. So it's manufactured by a company called Epicare Zenith. They're in Somerset, I should say in Lawrenceville, New Jersey. We are our sister company that we wholly own is a manufacturer of what is literally the most powerful FDA-approved laser hair removal platform on the marketplace. We're actually the last American-owned manufacturer of long pulse Alex and Nd:YAG laser systems used for hair removal. Right here in the United States, which is fantastic. The systems are sold throughout the whole world. We maintain an exclusive right to use them here in Houston, of course. No one else in Houston will have these platforms but us. But they are sold throughout the world, and they're very popular platforms in some of the most busiest of laser hair removal markets in the world. With that being said, we are going to use what's called an Alexandrite laser system for you here today. An Alexandrite laser system is going to be the best wavelength of light. We have an Alex and a YAG, but the Alexandrite at 755 nanometers has really high non-absorption, which is going to work really well for targeting your hair while safely avoiding injury to the surrounding skin. So it's going to be able to yield the best results with the fewest number of treatments. Cool. So you're a great candidate for the Alex, so that's what we're going to stick with. Now what we're also going to do is we're going to apply cold air to the skin while we're doing the treatment. At your last provider, did you remember cold air or was it more of a spray?
It's cold air.
Cold air? Great. So same thing here, it's a Zimmer Cryo 6. So you'll feel a lot of very cold air on your skin. It's a great way to kind of help numb the skin but protect it, make it a little more comfortable. I can adjust it, so just let us know. But with all that being said, it's the best way to cool and protect the skin. So we'll do the same thing here for you as well.
Perfect.
Yeah. So that's what we're going to use. So we're using our Epicare system, our Zimmer Cryo 6, yield a very safe, effective treatment. Now, the next question that folks normally will ask for us is, how many treatments are required by us, right? So you've alluded about 6 treatments, great results with the legs. Legs respond the very best on the whole body. So lower extremities respond very, very well. 4 to 6 treatments is typically what we'd suggest for your skin type and hair characteristic. For the areas that you're mentioning today, particularly the back, we'd expect about 6 treatments as well. Now the back has a very long resting cycle, so we may be spacing the treatments further apart than most, but with all that being said, we'd expect about 6 treatments and get very satisfactory results. Where we'd expect additional treatments might be in the facial region, where it gets a bit thicker, coarser, darker. We'd maybe go 6 to 9. But for the areas that you mentioned, I think 5 to 6 is a very good range for us to set today for a proper expectation. Now, do you remember at your previous provider, how far out did they space the treatments?
6 to 8 weeks.
Gotcha. So we're going to go a little bit further out here. So at Clearstone, we go about 10 weeks out on average at the get-go. The reason being is the hair must be there in order for us to treat it. If it's not there, we're not really going to do a whole lot.
Understandable.
So what ends up happening is with our technology and how powerful it is, we normally have to space our treatments out further than most providers, which is to say in 6 weeks with us, you're not going to have any hair present for us even to treat. So that is to say, we'll do a treatment today, and the hair will fall out, which will take about 12 to 14 days thereabouts. As it's falling out, as you know in the past, it looks like it's growing. Just shave it or just leave it alone, and it will certainly work its way out. And then you'll go this long period of time without any hair growth. We'd expect that to be another 6 to 8 weeks, meaning that from the point of today, that next growth cycle of hair, we don't think will start to surface for probably about 7 or 8 weeks following today. And then we want you just to shave for a few weeks before you come back to see us. So that way, when you come back at say week 10 or 12, there's a significant amount of hair from the next growth cycle present for us to treat. and that'll give us a very full, robust cycle of hair to treat, and we won't be treating too prematurely. And that ensures that every treatment is a very effective treatment. There's a good growth cycle of hair that's present and matured for us to be able to treat, and ultimately that will reduce the total number of treatments that you require. So with us, again, we go 10 to 12 weeks apart. I can treat you once every month, once every 2 months. The results at the end of 12 months is the same, right? So the idea is that as long as we're treating a growth cycle of hair that's robust and matured, we'll get a very high quality treatment. So we won't want to treat you too early.
Perfect.
Yeah. So
works out.
Alexander laser system, cold air is what we're using. About 5-6 treatments is the expectation, and we're going to space them most appropriately. Again, about 10 weeks. Your next treatment would be 10 weeks out. If at that time you're like, ooh, I don't really have a whole lot of hair regrowth, let us know. We push you another 2-3 weeks out. And then we keep pushing you out into the future until we have that growth cycle of hair, and then we know how long to schedule your appointments. Hey, it came right back at 8 weeks, we'll adjust accordingly. But generally speaking, 10 weeks is about right. A few things to keep in mind, some limitations. You're younger guys, so you don't have to worry about this yet, unlike me. We can't treat gray hair. Yeah, so my gray hair would be non-responsive, but you're not there yet. You have quite some ways to go. So a few things we can't treat: blonde, gray, unpigmented hair, gray hair. That vellus, that peach fuzz hair that folks have throughout their entire body, we're not going to be able to treat that either. It is possible though to stimulate vellus hair, or that unpigmented peach fuzz hair, and it would become a terminal hair, which is the dark stuff, the good stuff that we want to treat. If that happens, which is about 6% of the time, as the clinical studies would suggest, we could essentially double the amount of treatments that would be expected. So say we're treating the back, there's a lot of vellus hair present, we could stimulate that, it could become darker, and all of a sudden it looks like we have perceived hair growth, and we'd have to treat those cycles of hair as well. The first 6 treatments we'd expect to stimulate hair growth while also treating the hair that's present, and have to do another 6 treatments to essentially make sure that we're keeping up with the stimulated hair growth that's being caused. We'll get it eventually, but for that reason, we're only going to treat the areas that will be responsive to the hair removal process. We're not going to start treating areas that there is no hair present for us to treat. We want to balance that risk-reward. So if there's no reward, we'll avoid it. If there's hair there that will respond, we'll go ahead and treat it. And that's the best thing to do. So those are some of the limitations of laser hair removal. The big thing with Clearstone is speaking about the hair and the results. Like I mentioned, 2 weeks after treatment, the hair should have fallen out. We do offer complementary touch-up treatments. So every between week 2 and week 3, following the hair removal procedure, if you feel as if nothing, if there were non-responsive areas or see any striping, we'd be able to do a touch-up for you at no charge. But we want to make sure that's between week 2 and week 3 to try to keep the growth cycle somewhat aligned so that the next successive treatments are very effective. Again, today though, we're going to do a very comprehensive thorough treatment to avoid that. But if it were to experience the same, if you were to experience that, you just let us know. We'll touch it up for you, no questions asked, and you'll be all set.
Sick.
Yeah, so 2 to 3 weeks out, complimentary touch-up treatments is what we offer here at Clearstone Med Spa. Let's see, pre-treatment considerations, as you already know from your previous experiences, we just ask a close shave 1 day in advance of your appointment. The reason for 1 day in advance is that it helps to cut down on any potential razor rash. If you do it right before you come in to see us, we got some razor rash present that just essentially causes a little bit more discomfort, will normally lead to a little bit more redness and swelling following the treatment. So if we can avoid that, all the more better, right? So normally a day in advance. However, no waxing, plucking, or tweezing, as the hair must be there in order for us to treat it. So we have to have the hair present, so we can't be removing it from the follicle for at least 4 weeks prior to your appointment. For the back, we don't want you to touch it at all. So once we begin the treatments, those types of hair removal should be discontinued indefinitely. And then finally, no prolonged sun exposure, indoor tanning, or spray tans. 2 weeks.
I don't do that.
Perfect. So. Yeah, so just try to avoid that 2 weeks beforehand, and then you're all set. After the treatment, some post-treatment considerations today. As you alluded to, we see some redness. It's called erythema. It's actually a desirable side effect. We like to see it happen. We also like to see it go down. So with that being said, it's transitory. Give it a couple hours usually, and a lot of it subsided. We can apply a cream to help further subside that, or help calm and soothe the skin right after your treatment as well. We can see a little bit of edema, or what's called perifollicular edema. It's swelling around the hair follicle caused by the thermal injury that we just created. That also will go down very quickly. The longest it might last would be a day, but with all that being said, it's normally very transitory, very, very short-lived in nature, 30 minutes to a couple hours, typically speaking. And those are the 2 most common side effects. Like any non-invasive cosmetic procedure, there's always other risks as well. Those include a thermal injury to the skin, i.e. a first or secondary burn, pigmentation change, post-secondary infection that could be caused by blistering or as a result of blistering. Again, all these things are very uncommonly seen, particularly here at Clearstone Medical Spa, but because they are a risk, we have to, of course, speak about them. A histamine reaction or allergic reaction to laser is the same type of consideration, although if you've had hair removal before, no issues, so we wouldn't expect any issues this time. But a very small percentage of the population can be allergic to the laser system, and they'll get a rash or whelps while the treatment. And if that happens, just contact us immediately, and we know how to, of course, properly care for it. For that matter, if anything happens after the treatment that's unusual, worrisome, or just out of the ordinary, call us immediately, send us a picture, and we'll respond appropriately with the proper care. We've been in this for 13 years. Over 100,000 people have been treated by us. We've seen it all. So there's nothing that we won't be able to do for you.
Perfect.
And that's the big stuff. But otherwise, post-treatment, avoid any jacuzzis, hot tubs, saunas, warm showers, hot towel treatments, prolonged sun exposure, anything that might otherwise heat up the skin, so strenuous exercise, just for as long as the skin looks to be agitated. So give it at least 24 hours or until the skin has fully normalized, whichever one's later. Having done this before, you know that you can otherwise resume normal activities immediately. There's not going to be any downtime. Sounds good?
Perfect.
Cool. What to expect during the course of the treatment. So as you've experienced, good rubber band snap with each pulse. I can greatly customize the energy settings to make it comfortable. So you just let me know how you feel. I'll be asking you throughout the course of treatment. We'll maximize comfort and efficacy for you, so you'll be all set. But that's essentially what to expect throughout the course of the treatment. Other than that, I've already looked at your medical intake sheet. We know that you're not on any antibiotics. You haven't been on Accutane the last 3 months. You're not currently taking Accutane. Now, we screened you against any type of hormonal imbalance considerations or any type of supplements that might otherwise cause new hair growth. So you're all set for treatment, medically speaking. So we have you all set there. We don't have to worry about pregnancy, of course, with our male guests. So we're going to go ahead and skip that part. Treatment comfort, we talked about that. Zimmer cold air, I can adjust the settings accordingly. So just let me know, and we'll make sure it's a very comfortable treatment for you. But yet, of course, make it quite effective. And then, of course, for the side effects, we talked about those already as well. So we're set there. Having done this procedure before, you're already very familiar with the process. So I think we're all set. Appointment considerations, we just kindly ask if you do have to reschedule an appointment, just give us a 24-hour notice of cancellation. No big deal there. And then, of course, pricing. We already talked about our pricing, and we got you all squared away there. If we had any questions, we go ahead and answer those right now. And the last considerations, we have a cool referral program that we'll give you a card about on the way out. And then we have some great specials from time to time that we receive via email.
Sick.
And that's it.
Perfect.
Yeah, any questions?
No, none at all. You answered any one that I would have had. So
sounds good. All right. So that's a consultation, or certainly a consultative approach. And given the fact that we don't have any questions and everything's cleared for treatment, we'll go ahead and perform the procedure now and get this kind gentleman on his way. Sounds good? So, no recent sun exposure. I don't have a whole lot of prolonged sun exposure. No history of tanning. No spray tans or toner on the skin. Now, what I do see are these lentigines. So this right here, there's freckles. What we can do is a fairly aggressive treatment. So what we're going to see is, particularly in the center of the back here, the hair is a lot finer, lighter, and thinner. And it will have to be treated somewhat aggressively. To treat this effectively, we'd use quite a smaller or shorter pulse duration, typically about 3 milliseconds to 10 milliseconds. In so doing, what we're going to do is cause some crustation of these lentigines. So these freckles are likely to become darker after we do the procedure, and much like an IPL photofacial, they will darken up over the course of 7 to 12 days, and then they'll start to crust, almost like a scab, at which point they'll fall off, and then the pigmentation here will become much lighter, and there'll be a normalization of the skin. So we'll actually lighten these freckles after about 2 weeks. It's just like an IPL photofacial in that sense. So we want to make sure that we have consent and acknowledgement of our guest to be able to do that. Again, it's going to feel a bit warmer here. These areas are likely to become a little bit darker. They'll crust up, microcrustation of the pigmentation becomes darker, looks a little scabby, it's all soft, and then it's all set. So how does that sound? Make sure that's...
Yeah, it's taking care of a problem. So
not too unusual there in that sense.
You
got it. That's Yeah, this is a treatment consideration, so we want to give you a heads up there. And then let's see from the back perspective, it doesn't look like there's a lot for us to treat. I have a little bit on the shoulders here, maybe a little bit in the center here, but I don't have anything below here on the lower back, but correct me if I'm wrong.
It's right here.
Just at the very top? Perfect,
Yeah,
okay.
right at the very top, right at the very bottom.
Very cool. All right, so we're gonna treat right here and just around the shoulder area particularly, it looks like. Now we're using an Alexandrite laser, so I'm gonna use a red marker or a white pencil. I'm just gonna make a little note for myself. I can see where the hair here is gonna be present. I can see that we're gonna treat a little bit on the quadrant, on the lower, these two lower quadrants here. And then what I'm gonna do, because this is of course a black garment, I wanna make sure to provide some protection there, because if I do make any contact with the laser system, we're gonna cause a little bit of a reaction. We're gonna have a lot of absorption of energy within the article of clothing, which actually could go so far as to ignite. And we certainly don't want to do that. The best case scenario is we actually burn the article of clothing and destroy it. More likely it will cause a lot of smoke, singeing, and then possibly even ignite it into a fire. So to avoid that, white towel over those articles, still don't hit it, but at the same time too, it provides us a little bit of a measurement of safety. I'm going to do a little touch up here. I could either do this with electric razor or just this razor here. Anytime you're doing a dry shave, just be very cognizant of razor rash. So it's just a real light little touch up, nothing extravagant. The preference is to usually use an electric trimmer whenever possible because it will reduce some of the razor rash. But in this case, it's just so fine, thin, few and far between. A little quick touch up with this razor here will be just fine. Looks good. So we'll do the back side here, and then we'll have them stand up or sit up, and I can do the deltoid region pretty easily. Everything else looks pretty simple. Yeah, just a couple stragglers, and that's it. If we leave the skin, if we leave these hairs unattended to, and I treat over them, it'll singe that hair into the actual epidermal layer of the skin, causing a microcrustation, a burn mark essentially. That will take about 2 weeks to resolve. So we can avoid that entirely, as well as any associated pigmentation change, even if it's temporary, by just doing a close little trim real fast. We'll give our guests the goggles. Of course, the goggles have to be worn at all times, and the goggles that are supplied by us are particular for the wavelengths of light that we use in our clinic. Sunglasses would not be appropriate. Because, of course, we're going to treat a skin type 2, essentially. We're going to be treating on the Alexandrite laser system. I'm going to treat at 2.3 hertz, 10 millisecond pulsation, 15 joules of energy per centimeter squared. We'll do 3, 14, 18 millimeter spot size. So the lowest I would treat maybe about 1.8 or so. 2.3 would be the upper end of the range. It's going to be a fairly aggressive treatment. Very short pulsation. That's going to give us a real nice interaction with that finer, thinner hair. And fluence-wise, could be anywhere as low as 14, as high as about 16 joules of energy per centimeter squared. Again, with an 18 millimeter spot size. We're going to couple this with our cold air. So I'll make sure our Zimmer is turned on. Here's our Zimmer handpiece adapter. Now, like all laser systems, we want to make sure that we're triple checking the settings. So I know I have an Alexandrite laser here with the client. I'm going to go back and make sure I'm on the Alexandrite laser system. So that's my first check. I'm going to go ahead and turn the system on, place it into ready mode. I'll see my... I'm going to go back and I'm going to place the laser system to ready mode. I see that the ignition light is on. My aiming beam is also on. I check my aiming beam to make sure that it looks nice and crisp. There's no distortion of the beam. It's not fuzzy. And that's going to be an appropriate indication of that the installation is correct and there's no deformity of the optics. The first pulse again is a warning pulse. There's no energy that's emitted. I'm going to go back to the laser system. This is my second time checking. Alexandrite 755, 18 millimeter spot size, and now double check that. My hertz rate is correct. My duration and my fluence is what I want it to be. I look at the patient's skin one more time. Alexandrite, my last triple check, Alexandrite laser 755. So I have 3 times checked the wavelength of light to make sure it's correct. In his case, I'm going to raise him up a little bit with the treatment table. Again, remember to put him back down at the end of the treatment. But being a bit tall, I like to raise folks up so I can stand straight. That's much better for your back. Otherwise, you could always sit down and do the treatment while sitting. The Zimmer we want to pull forward to the actual treatment itself, but you don't want to use the hose. That's going to cause damage to the equipment. Make sure to go ahead and use the Zimmer. Make sure to actually use the handlebar on the Zimmer itself to bring it closer to you. Don't tug on it. Don't tug on it with the hose. We've already done our test pulse, and then I'm going to start right here. And what I'm going to look for is good reaction of the laser, of course, in the hair. I'm seeing really nice reaction. How's that feel?
I don't feel it.
Perfect. I smell a lot of plume. That's a great sign of a very effective treatment. There's no sense in me treating more aggressively. I started at 14 joules. I was thinking 15 initially. I went to 14 at 3 milliseconds. Great response of the hair follicle. Very, very effective. And our guest doesn't experience any pain or discomfort. This is the best of all worlds. Very, very effective treatment. Again, I could see the actual snapping of the hair follicle with the laser system itself. I could smell that burnt hair. Again, very important clinical endpoints to indicate effective treatment. My biggest concern right now is just out of safety. I know that given his skin type that this treatment is safe from, of course, our experience. I don't see any adverse reaction to the skin whatsoever. Again, I'm seeing excellent response from the hair follicle itself. Great singeing. Very, very effective absorption. So my main considerations now are just a solid 20-30% overlap with each pulse. Keeping my beam nice and perpendicular to my spot size. Or keeping the spot size nice and perpendicular to the skin, the target area. I'm using the lines created by this blanching of the standoff to overlap and provide a comprehensive treatment without any missed spaces. And we can see that, again, we're getting a very nice treatment result here. And that right there is the lower back treated very, very well. No complication. I see a little bit of redness. That's that wonderful erythema. That should be expected. Great result. Almost a textbook response from the skin. That's exactly what we want to see. How does everything feel? Nothing feels hot? Perfect. No continued tingling or lingering pain or discomfort?
Not at all.
Excellent. I see just a little patch in the center of the back here. I'll treat that. But again, remember, no good deed goes unpunished with lasers. If we don't have anything here throughout the back area to treat, you want to avoid it in its entirety. We can only make it worse. It can stay the same, but we can't make it better, so don't go ahead and treat it. Again, only focus on the areas that we know we're going to get a response. Just in the lower back area, as I marked off, a little patch here, and now we're going to go up to the top here. I see a little nevi right there. I can treat over this. I can treat the hair that's within here, and we'll get a nice response there. I do expect this to darken up though, and to perhaps start to pepper off, or pepper a little bit. And then, but I should mention, if there's anything that's suspicious, any suspicious lesions, want to make a picture, point this out to our guest. And then if there's any reason to be concerned, to go ahead and certainly refer out to a dermatologist for any further evaluation. But this all looks very, very typical. With the lesions here that we're going to be treating over, 14 joules of energy is going to be a little bit aggressive at 3 milliseconds. So what we're going to do is want to change it. Now the hair characteristic is really fine, light, and thin. So with real light, fine, thin hair, we got to treat it over a very short pulse duration. So I still want to keep my 3 milliseconds. I'm going to try at 13 joules of energy per centimeter squared and see if I need to take it up back to 14. But this should be very good. So we're going to go ahead and give this a try. I'm going to treat this in the lower quadrant of the upper back. And how's this feel?
Like nothing.
Perfect.
Wild.
So I smell a lot of singed hair. Again, that's the smell of success. That burnt hair smell, we want to smell that. Shows a very effective treatment. Again, at such a short pulse duration, being 3 milliseconds, it's very effective for this finer, thinner hair. But I do expect to have a very aggressive reaction within some of these tensiones. Consequently, it's definitely going to darken up in the days to come. And then after about 2 weeks, it'll pepper off, and the area will be more normalized, more even in tone and complexion, with those tensiones becoming a lot lighter at that time. So you can see I'm just using the lines that I'm creating in the skin with the standoff, that really fine, light, thin, white mark. That's from blanching. All that means is you put a little bit of pressure to the skin, you're actually going to very, very temporarily blanch the skin. You're removing the superficial blood of the dermis from that area by essentially squeezing it out of the capillaries. There's no pain or discomfort from it. It's very temporary in nature, but it provides for a great line. And I'm going to use that line to provide a great treatment. So this entire area was treated, nothing to it. And now I want to just treat the upper area here. So I'm going to have our guest probably actually sit up for me for this. There's a couple of different ways to do it. I'm going to have them sit up at the edge of the table here. I'm going to lower the treatment table. And I have a stool. We could have the gentleman sit on the stool. That'd be pretty easy. Or in this case, I'll just treat here because I'm pretty tall. It's easy for me to access. Now, always make sure to be mindful of black articles of clothing. Take your time. Make sure they're protected so that if we do have any beam waste or any laser system that is, or any laser that is errantly fired and would otherwise make contact with this clothing, it's not going to cause any damage to it. So go ahead and protect the clothing with a towel. And that's the best way to be certain that we're not going to cause any damage. You'll notice on the fiber is always on top of the cooling hose. Cooling hose is pointed down here towards the beam. Air blows this direction. This, of course, the orientation has to be right. You don't want this orientation blowing there needlessly. You want to make sure that this is turned around so the cold air is blowing against the targeted area, and that the standoff here isn't going to otherwise block or impair the flow of the cold air. Now I can see where I treated in the upper region here, so I'm going to just treat the very top portion of the shoulder. How's this feel?
Like air.
Perfect. No pain or discomfort. I still see great absorption of energy within the hair follicle itself. So I know we're doing a real nice job for this gentleman. I can smell that burnt hair. So at this point, I just want to make sure that we're doing a comprehensive job. Now in hindsight, I can see where I treated before, but you're probably going to want to put a marking exactly where you treated. That way we're not going to be missing any spots. And so we have what's called a t-shirt package. So if we treat back and shoulders, imagine a t-shirt. We're going to take the cut down to the deltoid region. So anything that's above this t-shirt is what's going to get treated. So we could draw a line with a marker that'll indicate exactly where the treatment is going to be, right? So if the gentleman's wearing a t-shirt, I have a deltoid region here. This is where the t-shirt's coming down. I already treated this area here. I've treated throughout the back area, so all this has been treated. I started up here, so we know that's good. This is the area right here I'm going to treat. You can break this up, treat this quadrant, treat that quadrant, then we can move to the front, and we can treat the top part here and finish out the deltoid. Now here I can notice a little bit of hair growth, so I'm going to take a razor real fast and just do a slight little trim on that. That way I'm not singeing any hair into the follicle, as I mentioned before, or hair into the skin. We certainly don't want to make those singe marks. If we do that, we could cause a little bit of burning to the skin that we don't want to see. So I'll do a little touch up here. I'll get you just to spread your arm. That's perfect. So you can see I'm just going to touch that up quickly. I can even use the Zimmer to blow away the area that I just touched up. And we're all set there. We can always show our guests the mirror as well. Hold the mirror up, make sure that's exactly where they want the line to be cut. And that way they know exactly where we're going to treat. And the guest is able to experience the area and coverage that meets their unique preferences. You can see from the posters in the room the actual coverage. Again, keep that spot nice and perpendicular. Be mindful of any tattoos. Perfect. So that's all set there. We'll do the front. And to do that, just have the gentleman relax. And then what I'm going to do is I'm going to treat this area here. Now, I don't see any hair here that's present for actual treatment. So I don't want to treat anything that's not going to respond. I see just a little bit of hair right here. So I'm just going to touch up this little spot. And we'll see that will actually conclude this shoulder area. Perfect. Now I do see a little bit of hair here. So I can see a little bit of hair in this region. So I'm going to go ahead and treat this quadrant here. How's everything feel?
Still like air.
That's good. No burning sensation. Nothing's hot. No lingering pain or discomfort.
Not at all.
Perfect. See again, I don't know if the camera's going to pick it up just right, but you can see the wonderful absorption of the energy into the hair follicle. Again, 13 joules of energy, 3 millisecond pulsation, working very, very well. Excellent. So you'll see that's the shoulder area, broken up nicely, treated in quadrants. When treating somebody's back shoulders, we're always going to be mindful of the neck. We're not going to style someone's hair necessarily, but we certainly want to be able to treat the back of the neckline if that's their preference. And it's a good thing to go ahead and take a mirror, help show them exactly the areas that we'll be treating. We could square it, we could round it depending upon their preferences, and of course the current style that's in place. We're going to purposely avoid trying to otherwise trim a flat line ourselves. We really want their hairstylist or their barber to make sure that the cut is just right, and we're going to outline that with the laser system and maintain that for them instead of us trying to go in with our trimmer and do a flat or curved structure. We don't have the licensure to do that, but nevertheless, when we make an appointment for a man and his back, the shoulders, let's go ahead and remind them of those facts, of that benefit. If they were to have a haircut before the treatment, that we would do a real nice job for them in helping to maintain the time between their haircuts, probably a little bit longer, because we can help prevent some of that back of the neck growth that otherwise might lead to an early haircut, or at least a touch-up, saving some time later. But this deltoid area is already done and set, so we're going to go over to this side, and I'm going to do the same thing here. I'm going to take a razor, I'm going to do a little trim, and then we're going to knock out this deltoid region. Yeah, I'm not pushing hard on the skin by any stretch of the imagination because I don't want to cause any unnecessary razor rash. So it's just a real light brush of the razor against the longer hair follicles just to make sure that I can get these stragglers trimmed up a little bit so as to not otherwise singe them in the skin. But don't give an aggressive dry shave. That's a great way to cause unnecessary razor rash, which will just increase discomfort of the treatment as well as increase chances of pigmentation or of swelling, which again is edema, or of course the redness, the erythema. I'm going to go ahead and mark this area as well. So again, we normally take out a mirror. We'll show our guests exactly the cut line. I'm going to do the same thing on the other side. I can just use a deltoid muscle to actually help illustrate where that t-shirt would naturally come down. So I'm going to do a cut right here that would follow a t-shirt for a man. And then I'm going to split it in half. I'm going to treat this half. I'm going to come up to the front. I'm going to go ahead and treat this quadrant all the way to the top. So quadrant 1, 2, and then I know I have this area right here that I'm going to treat. So that's my 3 quadrants when treating the deltoid region and the top of the shoulder area. And that way we know we're going to get a real nice, comprehensive, thorough treatment. And to help illustrate, so what we want to do during the course of the treatment, particularly when training a man, take out the mirror. You'll notice the mirror is always pointed down and away from the treatment room. We never want any reflective surfaces pointed into the room, but we can hold this up for the gentleman just to see, and now he can have a better perception of, okay, great, that's exactly where we're going to treat it. Does that look good to him? If it does, we could do it. If not, we're going to move it and adjust it accordingly to meet his style preferences. I can put a little curve in here that might follow the shirt line a little bit better. I can make it perfectly flat. It's all about just personal preferences. It's easy for us to accommodate those needs. Make sure you use that mirror. We're not using a mirror. Make sure it's pointed down, and we don't have a highly reflective surface in the room where the beam could otherwise reflect off that surface and go and hit something that we don't want it to come in contact with. So here I'm going to just split this up a little bit. I'm going to go halfway. For guys, it's really important to be mindful of the hair that's right in this back quadrant that almost goes unseen. It's not in the underarm area, but it's right outside of it. And you want to just trim that up nicely so that gives a real nice clean presentation from the back, and there aren't any small stragglers that you otherwise is contending with. And again, I'm just going to clean this up here. You could snake. The hair here is very fine and thin, so there's no discomfort that's being felt. I treated this on the back side, so you can see how this was already previously treated by me, which means now I'm going to do the front side. Move over to this side here. Again, I can see very nice absorption of the energy in the hair follicle. How's this feel?
Like cold air still.
Very easy to treat. I imagine this is a lot more comfortable than your previous experience. Yeah. So our laser systems, we use the most aggressive, most powerful Alexandrite laser system on the marketplace. That's a fact. No other Alexandrite laser system can produce more energy than this one can. With that being said, we don't have to use its full capability to get a great treatment, but we apply the energy in a very unique way. So we have a 3 millisecond pulse duration, but while that could be produced by almost every Alex system on the marketplace, our pulse envelope is unique. So we have a 3 millisecond pulse duration, but what it really is technically is 2 pulses within that 3 millisecond pulse duration, which allows us to essentially heat the hair up very quickly, allow a short period of time for the skin to cool off, and then to continue to heat up the hair very quickly. So it makes for a much more comfortable experience, but it also allows us to treat more aggressively. So we can treat more effectively with less discomfort than other systems on the marketplace. That pulse characteristic is unique to our EpiCare platform. No other system on the marketplace has that automatically built into it and theoretically set at the maximum or at the proper level to maximize safety and efficacy throughout the course of a treatment. It's made possible through our what's called capacitor bank and SCRs, the way that we discharge our capacitors to ignite the flash lamps in that pattern to again afford essentially 2 pulses within a set period of time. At 3 milliseconds, it's 2 pulses. At larger pulse durations, it's actually 4 subpulses that comprise our pulse envelope, really making for a very comfortable treatment relative to other platforms on the marketplace. So you can see the skin in the upper neck region. On the back, we went ahead and treated to the lower neckline. But the skin here is a little bit darker than it is in the surrounding areas, so we're going to want to make the proper adjustments should we want to treat that. If the gentleman wanted us to treat the lower back or the upper neck, I should say the lower neck, we'd have to do a trim here, and then we'd have to adjust the settings accordingly. From 313, I would adjust it to either 1013, 2014 in that range, or 1616 to actually afford a little bit more time of energy application and get the 4 subpulses instead of just the 2 subpulses. Just because the skin is darker, I don't want to apply the energy as aggressively. I would apply it over a slightly longer period of time to really afford a little bit more protection. I'm going to go here and just trim up a little something I see. I see a couple stragglers right there. And this will take me to where I treated the back moments ago. And this, of course, is all already treated. So that looks good there. We've done a nice job. We've trimmed this out. Again, we can always show with a mirror how far up do we want to take it. Does he want to have a haircut in the future? Have a barber really tie it up just exactly how he likes it, and we'll just trim it out. If you want us to do that, we would come up in here. We would treat the neckline going all the way back, and he would decide with the stylist if he would cut the neckline here or if he wants to cut it here. And then, of course, we would treat appropriately. So if you cut the neckline here, we would treat these areas here. And the manner by which we would do that, it's pretty straightforward and simple. What we would end up doing is we come in here and we treat throughout here. We would use this back into the standoff to guide down the line that the stylist carved into the hair, and then we would trim it out. The same thing back here, if the back of the neck, we could trim it out like this, and then we could go down, which is to say the proper way to do the man's back on the neck is to start down low. This is where the hair is finer, lighter, thinner. It's not nearly as thick. So what we want to do is we want to start down low, and we go and we retreat up to the neckline itself. Start down low, go and treat up to the neckline itself. And do that all the way through. Go to the center, and then go to the other side. Start out here, and do it for the other side. Come up to the center, and then at the very end, we could trim it out. So we can come up here and trim out the very top so it's nice and flat. We can also use a tongue depressor if we wanted to and have a very straight flat line. What that would look like is this. We could take a tongue depressor, which would act like a beam block. So let's say that this gentleman wanted us to have a very flat back. We could come in here and treat like this. And that would cause for a very, very flat, very straight line across the back. Because only the area here would be treated. The area that is the laser that makes contact with the tongue depressor, the energy would not penetrate through that, causing for a wonderful beam block and a very, very nice treatment. And that's the way that we could do that. We could do the same thing here too. If we want a real flat line, we could always treat like this and go straight down. And that would cause a very nice sharp line for a client, which would be wonderful. Again, it's always great to have the style prior to coming in to visit us, and we can get it just right. Never make any assumptions. Never try to style one's hair. That's, again, outside of our scope of licensure. But for the style that is presented to us, we can do a wonderful job of really cleaning it up and getting a nice, really flat, straight line that follows what the stylist has done. We can see already that some of the pigmented lesions here are becoming a little bit darker, but with all that being said, everything is responding very nicely. All the erythema has already gone down. There's a lot less redness than what he maybe has expected in the past. Again, deals with the energy and how we apply it. It's not quite as aggressive to the skin, but yet it's very aggressive to the hair. It's a little bit less erythema than what he's probably accustomed to, but should feel really, really good and very comfortable for him. So far we treated the lower back, the upper back. We've shown how to treat the shoulders. We've given the considerations for the back of the neck. Again, the back of the neck, I'd have him sit on a stool, and then we would treat the back of the neck a little bit more slowly because the hair is typically coarser, thicker, darker here. So we're going to treat this a little bit slower. We'll take it down to 1.3 hertz, 1.2 to 1.6 hertz. But treat slowly. Always start down low. Work your way up. Start off where it hurts less, then work your way up to where it's more sensitive. And we would do that throughout the course of the neck. We would create a nice straight line, either by trimming it out, using the standoff, or even better yet, a tongue depressor acting as a beam block to get a real nice, straight, flat line throughout our treatment. Again, he'd be sitting on a stool. I'd be right behind him. It'd be very easy for me to access the areas that I want to treat, and the quality of treatment would be very, very high and uncompromised. So that's the back of neck treatment. Again, make sure that we're treating into here. Be generous as it pertains to coming up to the upper level of the neck. So if this is the front neck, we can always show a mirror to our guests, but make sure that we're not just treating back here. Cover this area in here if that's going to better suit their unique preferences. And then make sure that we're not ever blowing air into the canal. We never want to blow cold air directly into the canal or into one's nostrils. All right, so that's the back. Let's go ahead and we'll do the front. I'll have our guest lay down. So he'll lay down on his back with his face up. So again, same kind of considerations. What we're going to do is we're going to give our guest a mirror to hold on to. So I got my marker. So we're going to go ahead and we're going to mark. Is this about the area you think here?
Yeah, about right above the diaphragm. So not right above the diaphragm, that's here. So right, probably in across there.
So we're going to do...
I think that's mostly the chest.
Now, do we want to come in and trim it a little bit? Or do we want a straight line and right across?
Whatever you think is best.
Yeah, so what we're going to do, instead of just doing a straight line up, what we're going to do is we're going to put just a little bit of a curvature to it, right? So we're going to come down right underneath the pectoral muscle, and we're just going to kind of trim this out a little bit. And that might be a better presentation than just drawing a straight line across one's chest for starters. And we can always further customize this. If he comes back, he's like, it looks great, but let's take it down a little bit further. Or, I'm just going to do the center line. You can leave everything under here untouched. We can always customize it at a later appointment. But I would start off with probably something that's a little bit more curved and kind of flows with the actual natural anatomy and then carves out the considerations without just making a straight line all the way across. So I'd start off with that for sure. We're going to make sure that these are even points, and I'm going to come up into here, and that's how I'm going to do the procedure. How does that look?
Yeah, it looks good.
Good. So we'll go ahead, we'll remove the goggle or the mirror, keep that out of the way so that doesn't come into contact with anything we don't want to treat. And then setting-wise, we can see that this hair is actually a little bit thicker. So I don't need to treat it as aggressively because that could actually cause a lot of unnecessary pain or discomfort. This hair, being a bit thicker and coarser, will respond beautifully well to a slightly longer pulse duration. Again, I'm going to do just a quick little trim up. You can do this very gently with either a razor or ideally a trimmer so we can avoid any razor rash. And that's it there. Perfect. If you hear the Zimmer beeping, that's because you only have 10 seconds left. You can just add more time to it and you're all set. I've changed the settings. I'm going to triple check again. Alex laser, Alexander 8 guest, red light. Double check my settings. 18 memory spot size, 2.3 hertz, 1616 is my new energy, 16 joules of energy. So I've been raising our energy from 13 joules to 16 joules. That's a pretty big jump in energy, almost 20%, over 20%. But with that being said, I'm also increasing our pulse duration to 16 milliseconds from 3 milliseconds. So I'm taking the energy and I'm going to put it over a much longer period of time. What I want to do is I want to find some hair to test this out on. And I can see that it's responding beautifully well. I got a real nice singe of hair. It's probably not as aggressive feeling as it was on the back, but the clinical endpoint is certainly there. So with that being said, I'm going to treat at 16 milliseconds with a little bit more energy. I think we're going to get a real nice result, but without any discomfort. I'm going to go ahead and make a couple markings. I'm basically going to treat this quadrant, this quadrant, this quadrant, and that quadrant. I almost forgot. I lowered him before so I could easily access the deltoid region. And being a tall guy, I'm going to go ahead and raise him back up. That way I don't have to bend over too much. Save my back. When you raise someone up, just really make sure that you remember to put him right back down before he gets off the table, as that way we can avoid injury to anyone. I see a little something here in deltoid. I can actually see how the 16 joules at 16 millisecond pulsation is picking up really nice here too. Saw a couple stragglers. I just want to knock those out. Now here, because the hair is so fine and thin, relatively speaking, I can go ahead and snake this if I want to, which is to say to go back and forth. How's this feel?
A little bit more like tweezers, but still good.
Easily tolerable?
Yeah.
How you doing? "16 joules of energy is a fairly good degree of energy application for sure. Really thinning off that longer pulsation for comfort. How are you feeling?"
Feeling good?
Look at the response. I know that I can treat less aggressively as well. Still get a great result. Might not be quite as effective on some of the finer, thinner hair, particularly in the outer regions here. So I like the 16-16 setting. But I could probably treat at 20-15, 20-16, increasing that pulsation further to get to aid in a little bit more comfort without sacrificing the quality of the treatment too much. I'm sorry. You doing good?
Mm-hmm.
I don't see anything else to treat down there. So that's that quadrant. You see again, good solid 20-30% overlap with each pulse, using those blanching lines to help track where I'm going, where I've been, finding a real nice quality of treatment. How you holding up?
Holding well.
Not too bad?
Could be worse.
Now these are long lines I'm doing. The hair here is pretty thin and light. If the hair is thicker, coarser, darker, I would split this up into 2 different passes, breaking it up so that the line isn't so long. Which say I'd start treating there, I'd go right to here. Break it up nicely. I wouldn't snake it. This will help with any of the discomfort. Give a little bit of time. I can use this lentigyny right here as a mark. So there's my lentigyny. So I stopped right there. I can go back here, finish the top up. So I know I've treated this entire area. I treated up this scalpel bone right here. I can see the nice erythema all the way across. And it's always up to guest preference. I can see the hairline here of the neck. So I'm going to look for any stragglers right on this real lower neck part, just to clean this up as well. Provided guest preference. And this way we can clean up the upper neck, or the lower upper neck. Not impact the beard region at all. But keep it nice and neat. So if we do this, we're going to want to keep, again, that beam profile nice and perpendicular. And you can see I'm going all the way straight back to give a real nice coverage to the whole lower neck. So I'm going all the way back. Even with the ear, I'm not going to start up here. I'm going to take it all the way back and go straight up. That way it's a real nice, clean, comprehensive look. And that's where I left off the back as well. It's all tied in nicely. And there won't be any missed spots. Marking that would be a really good idea, just so that when you're doing the procedure yourself, we'll know that we haven't missed anything. And that's the whole lower front neck as well. So everything's nicely tied in together. I'm not leaving any stragglers here in the periphery unattended to. We have a real nice pattern. You can see some real nice erythema, very consistent treatment lines. Everything's been treated from the markings. I'm going to look at the very front here, which I already did on the other side. Make sure I didn't miss any areas. Everything looks like it's very responsive. Nothing's been missed. Everything's tied in together with all my markings. Now we have a very comprehensive treatment. Again, a pretty aggressive response. A lot of erythema, a little bit of a swelling, a little bit of edema, but to be expected with thicker hair on the front area of the chest, lighter skin. It's very present, very apparent. But just like we saw in the back, it's going to reduce itself pretty quickly as well, which is to say it's very transitory in nature. It's not going to linger for too long. Perhaps a couple of hours at the longest. The vast majority of it will be certainly resolved and be gone. The biggest considerations, again, to avoid any post-care or post-treatment heat or stimulus. We certainly don't want to see anything that's going to heat up the skin. That would certainly cause a potential complication. If he were to be predisposed to histamine reaction or allergic reaction to laser, we would expect that heat application following the treatment could certainly spur that or lead to a thermal injury if for some reason the heat of the laser system was really at the cusp of causing a thermal injury. That's not the case here, but for certain of our guests it could be. So that's why it's so important to not heat the skin up past the treatment. I'm using just a simple baby wipe that's going to do a nice job of removing the marker for us. Again, the markers come off really well with the baby wipes, the white pencil, one pass with the baby wipe, and then you're going to have to follow it up with an alcohol pad or swab. And everything looks really good there. So while I have them in that position, what we're going to do is apply a little post-care cream. Again, something to help soothe the skin. You see a lot of that erythema present. So anything that kind of helps soothe it, I think it's going to go a long way for aiding in its comfort. Again, Clearstone always has a combination of a aloe vera cortisone cream or a nice post-care cream that's comprised of a vitamin complex that's known to help nurture, calm, and soothe skin. The aloe vera is going to be a little bit tacky, so as a consequence, you're going to want to use this a little bit sparingly. So a little bit will go a long way. Use too much of it, and his skin's going to start sticking to his clothing, which is never any good. The absorption of it's pretty well. Again, it's a 1% hydrocortisone cream that's in this compound particularly, which helps with a little bit of that swelling. How does everything feel?
Yeah, it feels fine.
Nothing feels hot. No lingering pain or discomfort. That sounds great. If someone after the course of treatment were to experience a sunburn sensation or a rug burn sensation, we want to keep them in place just to make sure that sensation starts to mitigate, go down, and that things start to become more comfortable as time progresses. If at any point a guest starts to illustrate or starts to notate that things are becoming less comfortable after treatment, or things are becoming hotter after the course of a treatment, that's an indication that we may have a burn on our hands, and the burn protocol has to be adhered to, where immediate action needs to take place to help mitigate any potential damage that could otherwise be caused from the laser animal treatment. Sounds good. So we're all set there on the chest. Let me go ahead and have you sit up. And then we're going to do a little bit on the back here. We'll take a quick look on the back. You can take your goggles off if you like. I think they have served their purpose uneventfully, which is always good. Sounds good. Nothing hot on the back either, I take it?
No.
Perfect. Excellent. And then I'm just going to go ahead and put a little bit on the shoulders, because that's of course where the tensions are at. I'd expect to see a little bit of interaction there with those sunspots. So we'll help to cool and calm that skin a little bit as well. We've got the deltoids all set. Everything looks really, really good. No missed pulses. All this is responding nicely down here. Don't have to worry about anything there. Wipe off this couple markers that I placed there. And this gentleman is all set there. Again, as I mentioned before, do not forget to put the treatment table down. That's a pretty big jump after the course of the treatment, so we don't want to take that for granted. Always good to kind of talk to guests through the treatment process. That way they know how thorough and comprehensive it is, as well as exactly what we're doing throughout the course of treatment and why we're doing it. Give a little bit of a method to our madness. Not bad. How's everything feel?
Everything feels great.
Fantastic. How does that compare to some of your previous experiences?
Much nicer, less of the tweezer pulling sensation.
Perfect. A lot more comfortable.
Definitely.
Very aggressive treatment, we could say. We see a great reaction on the skin, exactly what we want to see. So we have a fantastic response. We're going to space this treatments further out than other providers as an indication of that fantastic response. But yet we can do that with less pain, less discomfort, all the right combination of things to make sure that we remain a leader in the market for what we do. A lot of that has to do with just the quality of our system here and the unique pulse envelope that it goes to create, something that's just unique to this platform. And that's it. So that's the whole treatment now. We'll let the gentleman get back dressed, and he's set and ready to resume his normal activities today with really no downtime. He'll avoid hot showers for the rest of the day. Probably by this evening, everything else is going to go down. You can see the redness has already gone down substantially. He'll have a little bit of lingering redness this evening, but tomorrow morning it's all going to be gone. And then the tendinites in the back are certainly already starting to darken, so we know that those are going to lighten up in a couple of weeks once that pigmentation peppers off. But it should be a real nice result. Any questions, he'll give us a call, let us know. We'll make sure we attend to him. How's that? Pretty good?
Amazing.
We got it.